Good morning. Welcome to Health Talks. My name is Dr. Christopher Amoruso, and I thank you for dropping by and checking out this video. Today's topic is a topic that I want to cover because it's something that I don't think too many people realize is available to them when it comes to their health, and it has to do with alternative testing. Typically, most people's experience when they go to a doctor is a routine blood work, at least for physicals, let's say for a 1 year checkup, or I'm not discussing a specific type of health problem, but just a routine checkup. Most people are going to be run through a basic, what's called a CBC, a chem screen. Maybe they'll look at your blood sugar. They may look to see if you have any overt signs of an anemia, or check your liver enzymes, your cholesterol, and so forth. And then oftentimes you're usually brushed aside, or you're told if your cholesterol is a little too high that you need cholesterol medication, and you're advised to go on a low-fat diet. Or maybe if your blood sugar is a little high, they may tell you to either start a medication for that reason. But oftentimes we don't really learn anything specific from these tests about our real health, about our lifestyle, about what we're not getting in our system, whether it be minerals, vitamins, and other nutrients that really are at the heart of correcting the cause of the problem instead of addressing just the symptoms. So what I do in my office when we evaluate a patient, first and foremost, is we try to hone in on the areas of the body that most need attention. This is done through the history, of course, the physical exam, and then from there that leads us to where we want to go with testing. And like I said before, this can get very specific to the patient's needs, but in a general setting, there are tests available that I often refer my patients to, done by one specific lab in particular that I use is Genova Diagnostics. And their website is gdx.net if you're interested in kind of exploring some of the options that are out there. One of the tests that I love using through Genova is the ION test, which stands for Individual Optimized Nutrition. And that really gives us a real thorough picture of what's going on with the patient. So we learned several different areas of concern regarding the patient's health. First, we look at the organic acids with this test, and that gives us a lot of indications about B vitamins, some of the minerals that might be needed, amino acids. So that's important. There's also a section of the test that looks at your omega-3 and omega-6 ratios and breaks them down for us, gives us a better idea if you're in an inflammatory state, a pro-inflammatory state, or if you are doing well and are tending to be towards the anti-inflammatory. And that helps us to discern what supplements might be needed or what dietary changes might be needed. The test also looks at common minerals, calcium, magnesium, potassium, and it also looks at what are called toxic elements, or your mercury, aluminum, arsenic, and so forth, to see if you're holding on to toxins that we may need to address through either chelation or other interventions. And then the test also gives us a look at the detox pathways in the body, gives us a sense of whether you're in a state of inflammation where you might need anti-inflammatory support, whether it be vitamin C or other nutrients. And I find that very helpful in assessing the overall condition of the patient. They also do look through a urine sample at what would be an assessment of the probiotic bacteria of the gut. And how that works is simply that if we have a lot of bacteria growing that should not be, they produce compounds that show up in the urine, which obviously shouldn't be there in high amounts. And we can assess from there whether that might be an issue that needs to be delved into further. And of course, we tie this all in with the history. So if a patient comes in complaining of gastrointestinal symptoms, or maybe they have a history of antibiotic usage, these tests are very helpful in helping us to discern whether or not they need a gut overhaul and they need to go on a specific type of program that will rebuild and repair the gut. So not only do we get a sense of customizing the nutrition for the patient, but we also get a little bit deeper look into some of these other pathways. And I find this helpful for many, many times patients will come present to my office asking me, Doc, what vitamins do I need? And to be truthful, I have no way scientifically to tell you other than making educated guesses based on your physical exam, your symptoms, and perhaps your complaints. But I really don't have a specific tool unless we look at testing like this. And the thing that most people fail to realize is that the blood work that we get from our normal medical experience does not tell us any of that. It just tells us, well, your blood sugar is high or your cholesterol is high, and here's the drug you need. It never mentions anything about the condition or the overall status of the body, what nutrients we might be lacking, and what type of diet we might need to follow. So I think that Genova also offers a lot of other tests along this line that are helpful, and I encourage people to look at their website. They have a wonderful complete digestive stool analysis, which is a kit that's done right at home. I usually recommend my patients do the 3-day version of it, which provides a little bit more sample and a little bit more accuracy. And it gives us a way to look into the digestive capabilities of the body. So when we compare this to a colonoscopy, which is really just taking a picture of our intestinal tract and the internal environment, this is giving us a much deeper, broader look at not only whether there's inflammation present in the gut, but whether or not we have digestive difficulty. Is there stuff showing up in our stool that shouldn't be there? And also the probiotic bacteria. Do we have pathogens that are present and not enough good probiotic bacteria? And these are just a couple of examples of alternative tests that are available. And I think prophylactically, right, to be proactive with our health, these are the type of tests that really have value, because there really isn't value in going to your doctor for years and years, getting a routine blood workup every year, and then finding out one day after 10, 15, 20 years that, well, your blood sugar's high, you're diabetic, you have to go on a medication. And I just don't see the sense in that, because if you ask yourself, where along that pathway of all of those years that you were getting that test, did anybody come along and say to you, I think you're going to have a problem here. You want to intervene now and do something about it. Or you're depleting your system of this nutrient. I think you better intervene. So when we combine these types of tests with this holistic approach, we look at the symptoms the patient complains about. We look at what kind of physical exam findings we have. And we get to know how the patient is living their life and how they're eating. Are they under a lot of stress? These things all tell us about what nutrients and what factors they may or may not be getting enough of. And when we put this picture together, it really does give us a nice, complete view of how to help intervene and help improve the overall health of the person before problems start. And I think that's the biggest key. So I definitely encourage people to take a look at Genova's website. Now, certainly they're not the only company that does this type of testing. It just happens to be a company I'm very comfortable with. I think very highly of them. I think that their tests have done a lot of good, not only for my family, but for my patients as well. And they're certainly just the tip of the iceberg. And I think as time goes by, we're going to have even broader tests as technology improves that help us really see inside the person. But I think the key point is we have to get to know the patient and the person as an individual. We have to ask them, how do you eat? What is your everyday like? Do you exercise? Or is your day stressed from start to finish and you're just filling in the holes by, sucking down coffee with cream and sugar to get you by to the next, step? These are the things that really have to be intervened upon, and we have to help the patient to develop a healthier lifestyle. And I think these tests give us a wonderful tool scientifically to put down in front of our patient and show them exactly where they're faltering and prevent the disasters that might be coming down the road if intervention isn't an option. So I hope that you'll look into this. I hope this has been helpful to you. Certainly, I'm not saying that routine blood work in itself is useless. Certainly, we do a general blood work as well in our office that includes some of the less common things that maybe mainstream doctors don't look at. For example, HbA1c testing, which is known as glycosylated hemoglobin, to assess a little bit more clearly blood sugar status. Things like ferritin and other inflammatory markers like CRP or homocysteine. These can tell us to some degree as well, and so they're helpful. But I think that we need to see the broader picture with the patient. So should you have any questions, I welcome you to call the office or send us an email. We're online at www.dramoruso.com, which is where this video is posted. Certainly our website offers other information. You can look around and feel free. And I welcome any questions or concerns. Thank you for stopping by.